thought of spending healthcare dollars for people to sit in a classroom with a diabetes educator or a nutritionist or a health educator and teach them about a disease that's going to make them go blind, take their kidneys, cause them to have their legs cut off and die. The thought of paying for that education was very alien. It makes sense. The greatest oxymoron, and I'm not here to condemn an industry, please understand that, but the biggest oxymoron in healthcare, in my opinion, is managed care. Now again, let's see the show of hands. How many of you have kids, teenagers especially? Do you manage them? That's a joke. Nobody manages care except me. I'm the patient. I manage my care. The lack of compliance, the lack of adherence to medical care that we statistically know drives a lot of our costs is the result of people not doing what they should and ought to do. I can go to the doctor and he can tell me exactly what to do. I get that prescription filled, I decide to fill it or not fill it, I decide to take it as directed. 2 hours before mealtime doesn't mean oops at bedtime when I remember it. I can decide after 3 pills I feel better, I don't need it anymore, and the rest stays in my cabinet. Ultimately, patients manage care. There's a great article years ago on a totally different subject from a professor at Harvard, Business Review. But I remember a quote from him. He said, "You can manage processes, you must lead people." And I